wondered what it really takes to transform women's health beyond the doctor's office? Today, we're joined by Dr. Jessica Drummond, a leading expert who's moved from clinical practice to empowering women through health coaching. In this episode, we'll dive into why lifestyle medicine and a holistic approach are game changing for women facing chronic conditions, how AI is shaping up personalized health plans, and why health coaches might just be the missing link in modern healthcare. If you're focused or if you're curious about the future of women's health and want practical insights you can use, you're in the right place. Today, we are sitting with Dr. Jessica Drummond, founder of the Integrative Women's Health Institute. Welcome, Jessica.
Thanks so much for having me.
Oh, I'm happy to have you here. You've been in women's health for over 20 years, transitioning from clinical practice to education and coaching. Could you share your journey and what motivated this evolution in your career?
Absolutely. So I still have always maintained a small clinical practice throughout my experience, but we really lead now with health coaching in everything that we do because I started my practice back in 1999 working in orthopedics as a physical therapist and pretty quickly transitioned into women's and pelvic health. And what I noticed at that time was that our clients with and patients with complex pelvic pain syndromes, things like endometriosis, vulvodynia, bladder pain syndrome, and any other kind of chronic fatigue, chronic pain type condition, our tools as physical therapists only took us so far. And so a lot of our clients back then, because the surgical techniques were not as well developed, because we didn't have this perspective on kind of whole system, whole health care, integrating the different systems. And we still don't really have that very well in our conventional system. It's still very siloed. Like, if you have a knee injury, it only has to ever do with your knee. It couldn't possibly be your immune system or your nervous system, right? But of course, we know that with more chronic conditions, no matter where the expression of that condition is, it's often involving multiple physiologic systems. We didn't really have that understanding at the time, or we were very nascent in that understanding. And so a lot of our clients had very few options. They were dealing with things like opioid addiction and had difficult surgeries that were not particularly effective. And so I was like, at the same time, I had my first daughter. So she was born in 2003, and I was like really wiped out after that delivery, and I was really healthy before then. And everyone just kept telling me, "Oh, you just don't sleep for the next couple of years. Like this is normal. Every postpartum woman is like exhausted." And I was like, "Okay," because I didn't know. But I knew eventually that like something was wrong. I was exhausted, I was really worn out, and I started to understand through work with one of the earliest functional medicine physicians. Her name was Dr. Nellie Gross in Houston, Texas, and she worked with her son who was an acupuncturist, and they helped me to fully recover using essentially a shift to what we now call lifestyle medicine. I was actually talking to someone in the UK just this morning. They're calling it social prescribing. So this idea that what people do day to day, their basic foundational nutrition, their sleep schedule, their relationship to over exercise or under exercise, their social connectedness. These things used to be thought of 20, 15 years ago as like fluff, like, do this medical intervention. If you also want to eat more vegetables, fine, but it's not really going to do anything. And now we understand that how we eat, how we exercise, how our relationship is with stress, how our community relationships are actually even more impactful in some cases than even whether we smoke or not, which has always been thought of, or at least in the course of my career, as something that's pretty significant. So I began to apply these strategies with my clients with complex chronic illness. And we saw much better results from not just doing that, but combining that with physical therapy, with surgical interventions, with medical interventions. And I really began to understand that the foundational approach of lifestyle medicine of which health coaching is a part, because health coaching is the communication skill set that helps a person actually implement all these things that they know are sort of good for them, right? And so that combination, combined with really educating people about how all of their physical systems and their emotional systems and their community systems are connected, leads to much more sustainable results, especially for chronic illnesses.
Okay, wow. Your company offers specialized certification programs in women's health coaching. How has the market for these specialized skills changed since I guess you started, and maybe what opportunities you see for practitioners looking to expand?
Yeah. So we started in 2006 offering the women's health coach certification, which was sort of a specialist certification, if you will, at the time. Women were seen as this like special group. But of course, women are more than half the population. So decreasingly is women's health itself a subspecialty. And so we began with that perspective because at the time, and even now, there is much less medical education, medical research done on and for women. I think something like 4 times as much money is spent on, I can't remember exactly what it was. It's either erectile dysfunction or something that's like a problem, but maybe not as massive of a problem as endometriosis on endometriosis. So endometriosis is a women's health condition primarily that affects the entire body. It's like a benign cancer, if you will. It's extremely painful. It's as painful most days of the month, or at least some days of the month, as having a heart attack. So, and yet almost no money. I think it's like $2 per person who has it per year is spent on research. So even now, there's very little monetary and kind of attention on women's health related concerns, but it's not exactly a subspecialty as it was back then. So I think it's still an important thing to think about and talk about in those terms. But what has evolved in the last 20 years is that how we communicate with people about what they need from a health perspective has obviously gone from sort of offline to online, right? From doctor referrals to global digital education. And all of that is controlled now by algorithms, whether it's Google Ads, even ChatGPT or other AI tools, obviously social media algorithms, YouTube algorithms. So people are looking up more specifically the concerns that are most bothersome to them. So where we've come to really focus, and this is really interesting because on the one hand, I don't want people kind of siloed into like, this is my diagnosis, and then this is the only thing I care about, because as I mentioned, physiologically, that diagnosis often comes with things like comorbidities, and a lot of things affect it that are very multifactorial. But how people search for things is very algorithmic based on what they understand they're dealing with or likely dealing with. So we've evolved our certifications to be more fine-tuned subspecialty. So the certifications for professionals are broad thinking and multidisciplinary and intersystem of the body and mind, but they lead with the things that women are looking for primarily to get support with. So that's endometriosis and other chronic pain conditions, perimenopause and menopause, which is a very hot topic. But for both of these, there's a lot of misinformation out there, and advanced longevity, menopause skills. I think of menopause, once you're in menopause forever, sort of like once you're postpartum, you're always postpartum. But after 50, 55, women start thinking about longevity in a way that they do even, they start to maybe think about it at age 45 or even late 30s, but they're really thinking about it in their 50s, like how active and healthy can they be well into their 80s? And then the other thing we especially teach people is functional nutrition. So the idea that nutrition itself can be wider than food. and that food has particular healing properties that can be utilized to help people kind of maintain that optimal functioning of their nervous system, of their immune system, of their hormone systems, of their musculoskeletal system. So whether someone has an injury or an illness, or they're just burned out, or they're trying to maintain optimal performance, how they nourish their cells with food and with other things like sleep and exercise, and how they nourish their relationships and how they lean on things like recovery can help really support whether it's optimal performance goals or health recovery goals. So that's the kind of four search terms, if you will, that we focus on: functional nutrition, endometriosis and chronic pain, perimenopause and menopause, and then longevity.
Okay. Nutrition is so important, and I don't think enough people really talk about that or have that as part of, a way to help people just really understand what's good for them and what they're putting in their bodies. So you had mentioned a little bit about like ChatGPT and just searching in Google and things like that. What can you share about how like AI platforms are evolving, and how it's helping people's like personalizing their plans or health plans?
Yeah, what we're starting to see at the very nascent level. So interestingly, I have an Aura ring, which I've been wearing for 5 years, and that's
Oh, okay.
maybe even longer than that, maybe 6 years now. And that's a tracker that measures things like resting heart rate and VO2 max and sleep quality and things like that. And from the very beginning, that company, and there's lots of other tools like that. We use Garmin watches a lot of times in our clinical programs that look more at stress. Some have biases towards performance, some have biases towards recovery. But these kinds of tools have now been collecting data on people for 5, 6 years, maybe a little bit longer, depending on the tool and the company. And they now have big stores of data. And even from 5 years ago, Aura in particular was doing studies looking at helping see if that data could be predictive of when people were getting sick, so they could kind of, downshift a little bit, take better care of themselves, expose fewer people to things, take a break, because our society certainly is not very good at resting. We're very good at pushing through. So what I noticed on my Aura app, even this week, was like, oh, a new guide that can give you like specific personalized recommendations. This stuff is all in, again, kind of the nascent stages. But if you look at something like ChatGPT or Grok, which has some deep research capacity, so does ChatGPT now, there's more opportunity for us to kind of look at all of the published data at the same time through AI tools. Now, there are some roadblocks to that. We're not really there yet because not all of it is publicly available. There's copyright issues, there's access issues. And then to give personalized recommendations, we actually have to have input from individual data. And then you get into privacy concerns and risk. There's a lot of things to figure out. But the technology is very close, within 2 to 10 years would be my guess, that you could have someone with a particular set of, family history, genetics, current symptoms, medical history, and then combine that data with the larger data of science around that condition or those series of conditions that a person is dealing with, and essentially have a menu, a checklist, if you will, of what that person should do to heal. So here's your personalized recommendations: get 7 hours of sleep, walk 10,000 steps, eat plenty of carrots, like whatever the details
10,000?
are. Yeah, eat 1,000 carrots, whatever. But the reality is, what I know from working with literally at this point, 30,000 patients, clients in my career, is that humans don't just do what they know they're supposed to do. They need collaborative support from another human, and often from a group of humans, to implement that list, because that list is never going to tell you like what time to do it. What if your baby gets sick? What if you're traveling across time zones? What's the priority thing out of this list? What if you just got a new job? What if your mom's sick? Like, implementing health changes has so many layers to it of just practical time management, prioritization. What if you have a negative physical response? Like, let's say you start taking a medication or a supplement and you have a side effect or a negative effect. What happens if something that was working really well stops working? So there's always going to be these kind of physical challenges, practical challenges, and also subconscious challenges. With women, we often see like they'll be really doing a great job of implementing everything, taking great care of their health, and then they'll either self sabotage or something will sabotage them. Maybe they went too quickly. Maybe they tried to change things too much. Maybe that interfered with relationships. And so they pulled back a little bit. So I think health coaches are really the healthcare professional of the future. And I think a lot of people who are trained as clinicians, in any discipline, whether they're physicians, nurse practitioners, physical therapists, occupational therapists, acupuncturists, they can have a role in terms of both the recommendations and refinement of those recommendations and the coaching and implementation piece. But that will require a real shift in how we're trained because we have to think about being really collaborative with the person sitting in front of us and their whole being, not just giving them a checklist of recommendations, because that's going to be easy to get for anyone with access to an internet connection.
Yeah, having that extra support, not just the checklist, but like somebody to kind of go through with you and, kind of fill it out. How are you feeling about this? How do I support you with this? Love it.
Do that like over time too, and probably for at least months to years.
Okay. You had mentioned that we get to create this next phase of healthcare system. What vision do you have for the future of healthcare, and how can individual practitioners contribute to this evolution?
Well, I think there are multiple levels that we have to focus on. We have a massive problem in the United States for sure of just basic access to healthcare. And I think that's one of the areas that we need to really think about. How can we optimize our healthcare dollars and resources by, one of our master coaches on our faculty works in a health coaching program that's a private public partnership in the state of Connecticut where she's working with people who are low income who have chronic illnesses, such as things like diabetes and metabolic syndrome. Getting people together with a similar health challenge, living in a similar kind of situation, really helps brainstorm ideas, build collaboration, get more access to better quality food and safer areas to exercise. So I think expanding the funded opportunities for lifestyle medicine to be really foundational then helps when people go to community health centers and they're prescribed medications to support these conditions. They, one, either work better, two, they don't need them as much, or three, they can, lower the dose or things like that. So it lowers overall healthcare costs, but it does require bringing more humans, more collaboration, more access to resources to a broad swath of the population that really has very little access to healthcare at all right now. And then on kind of the other end of the spectrum, I think for people that do have resources, a lot of times health is not really the priority, right? Like people who are actively working in their 20s, 50s, they're trying to make money, they're juggling children. It's just like, they're going out on the weekends and drinking because they have so much stress. And so I think there's a real opportunity at those ages of people who are actively engaged in the workforce to help them prioritize both the time and the attention and the resources to kind of flip how we think about healthcare to kind of my evolution from like here's the intervention for this knee injury from this overseas trip and then you tried to run a 10K that weekend to like what are you doing every day? What's your sleep schedule? What's your nutrition? What's your weekly exercise schedule? And who is supporting you in that? It's not going to really be the role of a primary care provider because they're just honestly way too busy and we have a huge shortage of primary care providers in this country. So I really think health coaches can fill that gap for people not needing to see a primary care doctor because they're doing this week to week, day to day maintenance in support with support of a health coach and or a community and a health coach. So I think this can be really expanded if for health coaches that also have clinical backgrounds and clinical knowledge. I think even more beneficial to help with that kind of interconnection between the traditional healthcare system and then the day-to-day lifestyle medicine or social prescribing.
Okay, well, this has been great. Tell the audience how they can reach you.
So the best way to find us is on our website, integrativewomenshealthinstitute.com, or on Instagram at Integrative Women's Health. And feel free to send me messages, ask questions, and you can find a lot of free resources in our podcast and our blog right there on our website at integrativewomenshealthinstitute.com.
Well, thank you. Thanks for tuning in to this episode of The Wellness Growth Show. If today's conversation sparked something for you, hit subscribe so you don't miss the stories, strategies, and insights from the front lines of wellness innovation. If you're a founder, operator, or health leader exploring growth into institutional markets and have a story worth telling, I'd love to hear from you. Reach out directly on LinkedIn or YouTube. And if you found this valuable, share it with a peer or post it online. You never know who needs to hear it. Until next time, stay well, keep moving, and keep building what matters.